how does movement and medicine, from your understanding, come into play in the world of oncology or cancer care?
Yeah, well, fortunately, there is a field, a subset of oncology called exercise oncology. And this is a body of research looking at the beneficial role of exercise on patients, on those dealing with cancer. And one branch looks at prevention. So there's a significant body of evidence on exercise role in prevention. You know, from breast cancer, colon cancer, pancreatic cancer, there's percentages in terms of risk reduction. And there are reasons as to why that is. Okay. Um, so, so we can link, say, a reduction in risk in colon cancer, which is about 25% reduction in risk, pretty significant reduction in risk for people who meet the 150 minutes per week of moderate intensity activity versus those who do less. So,
Hmm.
a very significant intervention, a remarkable reduction in risk. And we know the underlying mechanisms for that are, one, you have better motility through the gut. So in other words, pathogens or things that cause, more likely to be causing cancer, spend less time in the gut. And also there's
Hmm.
improvements in bile acid metabolism, which is also, two kind of causal factors of issues in terms of colon cancer. So, and for different types of cancer, um, we can, one, see the reduction in risk, and secondly, we can see what the underlying mechanisms are. So that's for prevention. In terms of
Yeah.
therapy, even more remarkably, we can do the same. So we now know somebody with a primary, breast cancer tumor, for example, that has a hormonal expressed breast cancer, like estrogen receptor positive breast cancer. We know
Yes.
we know those who exercise more vigorously, higher volumes, will reduce their risk of a secondary cancer, can reduce their risk of metastasis, can reduce their risk of dying from that primary tumor by being more physically active. And again, we can see the evidence in terms of what underlying mechanisms are responsible for that benefit. So it's a wonderful area of research, and it's now outside of the research sphere and used in a very practical setting. So there are
Hmm.
oncology societies around the world. Australia is one, whereby patients who are undergoing, you know, uh, post-surgery, chemotherapy, radiotherapy, are taken under pretty serious exercise regimen whilst undergoing treatment. And those treatments, as difficult as they are, exercise actually helps alleviate some of the side effects of those symptoms. It reduces the risk again of secondary cancers, reduces the impact of nausea, say. It can help with fatigue. So it's actually now being used as an adjunct to some of those therapies, which is
Yeah.
pretty incredible. And that's now
Yeah.
becoming the advice is now becoming more popular around the world, where you have physical therapists, personal trainers, PTs who are trained in exercise oncology, who are part of the treatment pathway. And
Yeah.
there's remarkable evidence on again the reduction in risk of secondary cancer, the reduction in mortality, and oncologists looking at the reasons as to why. One really fantastic study that I saw recently was a study on prostate cancer. And so for prostate cancer, one of the markers that are looked at is known as a PSA, prostate specific antigen. So it's a blood marker which is looked at to detect, one, if there's any abnormalities, but also if you do have prostate cancer, it basically can track the progress of disease or the effect or impact of treatment. So the higher that level is, PSA level, usually the more harmful it is, right? And there's a study done looking at 12-week intervention of those early stage prostate cancer, where this is before they need surgery or they need radiotherapy or anything like that, but they wanted to see, could they keep PSA levels suppressed just through exercise alone. So one cohort, 12 weeks, pretty hardcore exercise regimen. The other cohort just went about and did their usual thing. The cohort doing exercise, structured exercise, their PSA levels came down significantly. So they had huge drops in PSA levels just with exercise as an intervention. So this is now has come to the stage where we're likely to see exercise prescriptions being given for management of cancer, as well as other chronic diseases. So this evidence exists for people dealing with multiple sclerosis and Parkinson's. One of the best interventions for Parkinson's is actually physical activity. Obviously helpful for people dealing with, say, osteoporosis, maintaining bone density, people dealing with Alzheimer's and dementia. So diabetes, you can significantly reduce the risk of going from pre-diabetes to full-blown type 2 by incorporating more movement in your life. And again, there's evidence to support the underlying mechanism. So yeah, we could go on and talk about lots of different physical conditions and ailments, but one headline that I think is one of the most important for anyone to remember is that there can be up to a 50% reduction in all-cause mortality risk comparing a physically active person, so somebody meeting the minimum guidelines, versus those who don't. And this 50% reduction in risk of all-cause mortality is what scientists basically state as any cause of death. So pretty important as a headline, and up to a 50% benefit is more significant than any other intervention you can think of. So when we think of movement, in terms of that benefit, if movement was a pill, if we could take that pill and all reduce our risk of chronic disease by 50%, wouldn't that be amazing? But even more amazing is the fact that we can take the pill as long as we do the movement, right?
Take the movement pill.
Take the
I
movement
love
pill.
it.
Yeah.
I love it.